When I was pregnant with Andrew, at about my 28-week ultrasound, his stomach was smaller than it should have been. And then when he was born, he was only 5 pounds. His primary care physician, Dr. Link, did kind of have concerns about his weight. And he did kind of start to gain, but he was under the 3rd percentile. So that was a bit concerning. And because of that, Dr. Link decided to refer us to genetics to see if maybe there was something else going on. And she did notice some abnormalities with some of his measurements. They did some blood work. And the blood work came back that he had ring 4 chromosome. The really neat thing about the type of test that they did is it didn't come out until 2007 when he was born. That test can determine how much genetic material is missing. So he's not missing that much genetic material, but it is incredibly rare. Some comfort that we have is that they've done x-rays and all kinds of tests, so we know that as of this point, except for his size, he's completely normal.
The doctors at the university there were really helpful, and they did an excellent job of explaining everything, and they make you feel really welcome as soon as you walk in the doors.
Dr. Dustiker in the growth clinic is amazing. She's become kind of a very close friend of ours. She does ask questions about, has he had any illnesses lately and everything like that. So it's not just related to his growth. She inquires about every bit of his health. And then Dr. Link, who is both my boys' primary care physician, is amazing as well. And I actually credit her for being the one that sent us to genetics, for being the one that thought maybe there's something wrong with him genetically. And I can't thank her enough for finding out so early on what was going on with him.
Andrew's actually doing very well. We are continuing to follow his growth, and he's likely to be smaller than most children his age, but he's progressing very well. We hope that his development will be normal in the future, and we anticipate that he will live a long and healthy life.
There was tests that came out in 2007, the same year that Andrew was born. They couldn't have found how much genetic material was missing on Andrew prior to that. So in my opinion, they are pioneers.
We are University of Iowa Children's Hospital.